back to winning isn't easy. What medical testing will a disability carrier expect in my Meniere's disease ERISA long-term disability claim? Meniere's disease, known as MD, is a disorder of the inner ear that can make it difficult, if not impossible, to work. Your physician will diagnose Meniere's disease if you have 2 or more episodes of vertigo, which is the feeling of spinning or moving while you're still, that lasts 20 minutes or so to 24 hours. Your vestibular system, which includes your inner ear, your eyes, and the nerves connected to the brain, help us with the balance, coordination, and posture. Vertigo happens when your vestibular system just isn't working correctly. There are, however, some other common symptoms of Meniere's disease, along with the vertigo, that the carrier is expecting to see. There can be hearing loss that changes from better to worse, known as fluctuating hearing loss. There can be a sensation of air pressure where your ear feels like it's full or plugged, or there could be a ringing or buzzing or other noise in your ear, known as tinnitus or tinnitus. Any one of the combination of these symptoms can be the basis of a long-term disability claim. Now, the reality is that disability carriers or plans hate these claims because they're based on subjective complaints. The vertigo, the sensation of ear pressure, the ringing or buzzing or other noise in your ears. Now, those symptoms obviously can make you feel sick, tired, or make it difficult for you to pay attention. And the disability carriers tend to discount those complaints too because there's no objective basis for the diagnosis or those symptoms. But what they will want to see, of course, is a history of your symptoms in terms of the frequency of your symptoms, the nature of your symptoms, how long they last, what problems you have performing your occupational duties when you have those symptoms. And they're also going to be looking for hard medical evidence. They're going to be looking for audiograms, the results of VNG or ENG testing. They're looking for other testing, including an MRI of the brain, and testing known as ECOCHG, where they're testing the cochlear portion of your ear. Now, I will tell you that the lack of medical testing can doom your disability claim. And if you have the testing and it's negative, that certainly is helpful. If you have the testing and it's normal, that also can be a problem. And it's a problem that needs to be addressed in your medical records before you stop work and apply for benefits. What you really should be doing is having an experienced ERISA disability attorney review your policy, review your medical records, and give you recommendations for the documentation of your symptoms, your functionality, and how to deal with negative medical testing. Got it? Please don't make a mistake that could destroy your Meniere's disability insurance claim. Let's take a break.
Professional with questions about your individual disability policy? You need the Disability Insurance Claim Survival Guide for Professionals. This book gives you a comprehensive understanding of your disability policy, with tips and to-dos that will assist you in submitting a winning disability application. This is one you don't want to miss. For the next 24 hours, we're giving away free copies of the Disability Insurance Claim Survival Guide for Professionals. Order yours today at disabilityclaimsforprofessionals.com.